Hi there, my name's Alex Langdon and I'm a medical student from the University of Nottingham. Today I'm going to be presenting a project that was carried out earlier this year by myself and other members of the University of Nottingham and Nottingham Biomedical Research Centre. So this study looked at the assessment and management of coexisting dementia and hearing loss within UK audiology services. So a little bit of background to this study. So hearing loss and dementia are two conditions which are both increasing in prevalence as our society ages. And there's a lot of links between the two conditions. So they commonly coexist. There's a lot of people living with both conditions. And hearing loss has also been identified as a modifiable risk factor for developing dementia itself. Having dementia can also make the assessment and management of hearing loss a lot more difficult. So it's really important that audiologists are able to adapt the care that they provide for this patient group. But despite this, there's very little known regarding what the current audiological care actually looks like for people living with dementia, and also what the optimum audiological care would be. So this brings me on to the aims of the project. So the first aim was to understand the current clinical provision for people living with concurrent conditions within UK audiology services. And secondly, to come up with recommendations for how hearing loss and dementia should be managed. And this will be done by consulting professionals and experts by experience. So in terms of how the project was carried out, it was an online qualitative study and it had two stages. So the first stage was an open-ended survey with 37 UK audiologists, and we asked them questions such as if they had a specialist dementia pathway in place, or what adaptations they made for people living with dementia and how it looked different for their standard care for people with just hearing loss. And then there were follow-up interviews which were carried out with 13 of these UK audiologists. And then the second stage involved two semi-structured workshops with experts by experience. So what we mean by this were people either living with hearing loss and or dementia themselves, or they were carers for someone living with either one or both of these conditions. And all of the participants were recruited via purposeful sampling, and then the data was analysed via content analysis to come up with themes for key areas which audiologists made adaptations to care, and key areas for improvement in audiological care for this patient group in the future. So the key findings from the survey, the first stage of the project. So we found that there was a lot of disparities between UK audiology services. So although there were a lot of services which said they did have specialist dementia pathway in place, almost as many said that they didn't. And a lot of them said that they did follow a dementia guideline or protocol to guide this care. However, this wasn't a standardized national protocol, which they all followed the same thing. This was usually an internal procedure or protocol, so it looked different for each clinic. So moving on to some of the key areas that audiologists made adaptations within their care for people living with dementia. So the first area is how they adapted assessing hearing loss for this patient group. So one of the ways that audiologists did this is making adaptations to the tests themselves. So, for example, in pure tone audiometry, a common test used to examine hearing, they used verbal responses for people living with dementia rather than non-verbal. Some audiologists described modifying the testing environment to make it more calm and less intimidating for people living with dementia. Others described using additional tests, so this was sometimes using more objective tests, and some also described the use of cognitive assessments within their services. And then this idea of personalising assessments and personalised care came up across the survey, so that there isn't a one-size-fits-all approach, and the assessments would be adapted depending on the extent of cognitive impairment. And this here is just an example of one of the quotes from one of the audiologists about how they adapted the environment for their patients who were living with dementia. So moving on to how audiologists adapted their interventions and management for people living with dementia. So some described using alternative interventions to hearing aids, so things like assistive listening devices. Some described adapting the hearing aids themselves, so making them less complex and easier to use, or not charging for replacements if they were lost. Others described involving other services a lot more for their patients with dementia. So this included things like GPs, specialist dementia services, care homes, and speech and language therapists. And finally, this idea of person-centered management came up a lot as well. Moving on to how follow-up and ongoing care was adapted. So a lot of the audiologists described that follow-ups were initiated by the practice or the audiologist rather than the patient. They also described that a lot of their follow-ups were carried out face-to-face for patients living with dementia compared to via the telephone for people without any cognitive impairment. And finally, a lot of them described having more frequent appointments and follow-ups for their patients with cognitive impairment and dementia compared to those with just hearing loss. And finally, some of the general approaches that clinics made for audiological care. So this was adaptations which didn't fit into a certain part of the audiological pathway. So this was things like specialist dementia training for their staff. So again, this varied between clinics. Some had specialist dementia training, some didn't. Those that did, the training differed in what that might look like. So some described Alzheimer's Society Dementia Friends training. Some described having dementia training from their own NHS trust. Also, audiologists described adapting appointment lengths for people living with dementia. So some described having longer appointments, and then others described having multiple shorter appointments. And finally, a lot of audiologists spoke about how relatives and carers were involved throughout audiological care, assessment and management for their patients living with dementia. Moving on to the second part of the study, so the recommendations from people with lived experience of hearing loss and dementia. So some of the key areas they felt needed to improve for the future were things like appointment length and setting needed to be adapted and made more comfortable for people living with dementia. They felt that there needed to be improved training in dementia and hearing loss, so not just for audiologists, but across the health and social care staff that would be working with people with both of these conditions, so GPs, dementia specialists, care home staff. They thought the involvement of carers and relatives needed to be improved, but also adapted to each situation. And they felt communication and collaboration with patients needed to be improved, as well as with other disciplines who would be working with these patients. And finally, this idea that care needs to be patient-centered and flexible was apparent throughout the workshops, as they recognised that every person with dementia is different and will need a different approach. So the key things that this study showed us is that there is no standard practice or pathway for assessing and managing hearing loss for people living with dementia, with different approaches from different clinics. It also showed us areas for improvement in the future for audiological care. So as I mentioned before, care needing to be more patient-centered, flexible, interdisciplinary, better dementia training, greater involvement of carers and relatives. And some of the ways this could be used to help future research and clinical practice is we feel that national guidelines for the management of coexisting hearing loss and dementia would help reduce some of these disparities between services and optimise care. So thank you very much for listening. My email is just there should you want to contact me with any questions.